All right, I'm going to show you how to do your glute med isometric exercise. So I want you to stand close to a wall, but not too far away. The farther away you are, the harder you're going to make this exercise. So when you're first starting, kind of start pretty close to the wall. So I'm using a yoga block for this exercise. So I'm going to use that as a measurement of how far I want my body to be away from the wall. So I want to be about a yoga block length away from the wall with this exercise today. So before we do anything, what you want to do is find your alignment. So the goal is making sure that you feel that you're lengthening through the spine, but you're not allowing the ribs to start to flare upwards. So we want to control that extension through the body to lengthen, but my core is engaged to keep my ribs secured down into my body so that I'm not arching my back. Okay? So my body weight is pretty even into my feet. It's important that you create that tripod distribution of your body weight into your feet for this exercise, with weight equal between underneath the knuckle of the big toe, underneath the pinky toe, and then the heel. So think about that upside down or inverted triangle that we're creating with our feet, so that we have a lot of support and our feet are helping us maintain our stability through our legs. Knees are going to be soft, never locked straight. Otherwise, it's going to throw you into an anterior pelvic tilt if you lock or even hyperextend your knees. Okay? So find your alignment, and you always want to do your breath check. If I take like a nice breath in through my nose, keeping my shoulders relaxed, do I feel my breath expanding into the back of my body? If it is, that means I'm in alignment. So what you're going to do here is you can kind of hold on to the wall a little bit to get yourself set up, but you're going to start off with placing the knee on the wall, okay? And so when you place it on the wall, what we're going to do is we need to maintain our alignment. So we're going to do our breath check, see if we have our alignment. Do I feel it in my back? Great, I sure do. And so from here, what you're going to do is that you are having a majority of your weight into that right leg, and you're going to push that left knee into the yoga block. I'm not pushing so hard where I'm tipping my body off into the side, but I'm also not leaning my body into the block to get the push. I am using my leg, and I want to stay upright in a vertical position for this exercise. I want my body to remain over my pelvis at all times. My knee is soft, and as I push into the block, the majority of the work that you're actually going to feel is going to be in that standing leg. So we're going to feel a lot of activation on the side of the thigh. And then in this position, you're going to take deep breaths into it. And I want you to feel it in your back, not in your neck when you're breathing. Try to hold it for first 15 seconds, building up to about 30 seconds, and then you'll switch to the other side. So that's going to be our glute med isometric. And you notice that once I get the block up, is that there is a little bit of a softness into my hip. I do not need to have my leg completely straight and my hip completely straight too. There is a little bit of a softness in my hip as well as my knee, so that I'm not locking everything straight and I have to use my muscles for this exercise.